And the reason I was attracted to facial plastics and reconstructive surgery is because this is somewhere where I can really change care for patients.
The goal of head and neck reconstruction is to have the patient back to normal as quickly as possible. The goal is imperceptibility with normal form and function.
To understand that they're in great hands, that we have an amazing team that is going to take care of them.
I'm really excited to be part of the Center for Facial Reconstruction and Facial Nerve Disorders, the first of its kind in the country.
We do a lot of facial reconstruction at the Cleveland Clinic. It's not necessarily performed by one department. We've brought everyone together under one center. It spans 7 different institutes. There's over 50 care providers involved.
In parallel, we've developed sophisticated databases, so we will be tracking the outcomes for every single reconstructed patients we have, and then we have a process in place where we review those outcomes.
This is also where we innovate and really push the boundaries of what's being done in facial reconstruction and facial nerve disorders. Having the ability to collaborate with colleagues, even within my own subspecialty, is something I didn't see happening elsewhere in the country.
Any patient of any age, newborn to 90s, who has something wrong with their face, head, or neck, so that could be a deformity or an injury from any source. They're born with it, it's caused by an injury, a lot of the times from cancer treatment, nerve damage. We have experts within our group who deal with it routinely.
We've transformed how people think about microvascular surgery. We've turned a huge operation to now sometimes an outpatient operation. And we use tissue transfer. We can transplant patients' own tissue to rebuild things that nobody would ever thought of before.
We've developed what we call minimal access techniques, using small incisions to approach vessels to use for reconstruction, minimize the incision on the patient's face, shorter inpatient stays, leading to a more aesthetic outcome, and overall quicker recovery for patients.
We feel pretty confident that the pace of innovation here over the coming years will meet or exceed really any place, anywhere. But we can't even come close to resting on any of these areas, because until patients can consistently function and feel and look normal, then our work isn't done. You can feel confident that if any place is going to have a solution for your problem, it's probably going to be here, because we have such a diverse and experienced team.
We have more innovative techniques. We're more comfortable doing larger surgeries that result in better outcomes.
These are people recognized around the world as experts in their specific fields that come together to care for patients.
That's what makes reconstruction here so exciting.